So a thumb joint replacement is a good procedure for people that have bad arthritis at the base of their thumb. This typically affects women more often than men. And typical symptoms that someone might just have with thumb arthritis is pain when they go to pinch or grip objects. Turning doorknobs is a classic one. Oftentimes, once conservative measures fail in terms of bracing and anti-inflammatories, possibly injections, surgery becomes an option. Essentially, the thumb bone that tends to wear out is the trapezium, which is right here at the base of the thumb. And essentially what I do is I make a small incision about this big, I remove that arthritic bone, and then I borrow a tendon from the front of the wrist here that's really not needed, and I put it in its place like a little shock absorber. Prior to surgery, these are the x-rays of someone who has advanced arthritis at the base of the thumb between these two bones where it's very tight, and you can see a bone spur here. And after surgery, this is what it typically looks like, where you have a nice open space, and this is where the tendon sits as the shock absorber. I like it because there aren't any sort of implants in there that could potentially become infected or break or loosen, is the reason that I favor this technique. So the logistics of the procedure themselves is it typically is an outpatient procedure. The overall duration of the surgery itself is actually less than an hour. You go home the same day, so it's outpatient, and you'd be in a splint, and by 3 to maybe 4 months, you're able to regain your pinch and grip strength back. So the reason the procedure is worth it is because it would essentially get rid of your pain forever. And you get back to your baseline level of functioning, you're able to hold objects, you're able to open doorknobs, and just be able to live your life not having to have achy, sharp pain at the base of your thumb.